I will first just try to share. Power. Can you see my screen? Can you confirm if you are seeing my screen, please? Can you confirm if my screen is shared?
Yes. Sure.
Yes, no? Good morning, everyone. Thank you for attending this in service. I apologize for coming in late. We were in the huddle, but for this time being, I would like to welcome you all to this presentation. I want to present to you the tips for you to manage your time and how to be productive while we live our life. Okay, so the objectives of this presentation is to first know the tips on how to efficiently manage time as a team leader and or as a bedside nurse, and learn how to apply these tips in the context of nursing in SBAC. So it's specific to our city on nursing in the city. Okay, and they understand the importance of work and life balance. So why? Who am I? Who am I? Why did I present it to present this topic to you all? I've been here for 12 years and 9 months, and I started working here in November 2 of 2008. I was a staff nurse 3 as employed and a 24-year-old guy who was enjoying life. And by 2010, I was promoted to staff nurse 2, 2014 as an acting charge nurse, 2015 as a charge nurse, 2017 up until now is the nursing service manager. So I've been in the ranks and I came here from staff nurse 3 up until this point. So during this particular time, I really was enjoying life and I was working. So that's the reason why I have included this slide for you to be able to understand that I understand the situation and I understand what is happening in the ground. So these are the 7 tips of management tips for in managing time for nurses. First is consider using the Eisenhower Matrix. I will discuss it one by one later on. Have a shift planner or a to-do list. You practice time blocking. You learn to hack the Parkinsons Law. You have a highlight of the day concept. You always prepare for any urgencies or you mix urgency. You treat urgencies as part of your routine. And then you make sure that you do effective communication. 7 simple tips, and then later on we will do a summary of them and its application. Eisenhower Matrix, what is it? It is a productivity, prioritization, and time management framework that categorizes items according to their urgency and importance. It has the concept of the do, the delegate, the decide, and delete. It shows like this. You have your x-axis and your y-axis. X-axis being your urgent and non-urgent, your y-axis, your x being the important, non-important, your y with the urgent, non-urgent. If it happens to fall between urgent and important, these tasks these tasks needs to be done right away. So there must be an action to do right then and there. If it's important yet not urgent, you have to decide: are you going to do it right now, or you have to do it later on? Okay. If it's urgent but not important, then you can delegate this. These are some of the examples. It's not in particular. For example, if urgent and important, it falls down there that referring a vital signs or the patient who suddenly have an altered level of consciousness, it is very important that you must refer that right away. It's urgently needed by the physician, or there's an urgent need for a patient to be referred. So it must be it must be in a do phase, so it must be done right away. So these are some of the examples. Time with the family, going to the gym, you have to decide, do you have the time? Yes, these are important, but do you have the time right now? These are not urgent things. It can be rescheduled. Send a message. I will call you later on. If it's not important yet it's urgent, like for example, there is a schedule for a patient for an X-ray, right? You are not the one to send this as a team leader. You should not be the one to send this patient to directly to the radiology. You need to delegate this to somebody who is free at that particular time to send the patient to the radiology, right? Because that's not important for you, although it is urgent for the patient. Right? If it's not important yet not urgent, then you have to delete it, right? If it's personal phone calls because you're in the middle of something, yeah, opening up your mobile phones for your Facebook account, viewing your Twitter, Instagram, whatever it is, if you are in the context of the work, there is a time for that later on. So delete that in the matrix. So this is Eisenhower Matrix, and it helped me a lot. It is still in front of me right now in a whiteboard. Okay, so I am utilizing this ever since then. I am still utilizing it now. So I'm encouraging you to try and utilize this shift planner, or a to-do list. A shift planner or a to-do list might be a pre-developed list, meaning for a list of admission documentations. These are pre-developed list. Or a shift planner can be an impromptu planner. It can be developed during the handover, right? What are the items I need to, like for example, for the resident, these are the items that I need to discuss with him. For the consultant, these are the items that I need to. These are the lists that you are developing in an impromptu basis once you receive the handover, or you in the middle of your shift have developed in order for you to complete. This will ensure that all of your work are complete. It decreases the chances of error, and it prevents you from doing three times review. You review four times because you forgot if you have entered this data or not. By doing this to-do list, before we if you are fairly new to it, you need to have it written. But for seasoned nurses, for seasoned, it's just you either you can use your phone, or you can just put it in your memory bank. Like, for a fact that you have done this, then that. It's a matter of practicing it. So I suggest that you write it in a piece of paper, or you for you to be guided accordingly. These are two of the examples of what I'm referring to, the pre-developed list. This is an example of an admission checklist for adult. Yeah, you put the name of the patient, the MRN. This is what staff usually brings with him to the bedside. Goes to the bedside and have this lagged, okay, so that he will be guided already that he needs to still needs to get the vital signs, the measurements, the right calf, the left calf, and so on. Because all of these are needed when he sits down in front of the computer later on to document everything. So this is a pre-developed. If you wish to have a copy of this, you can ask me, or you can personally ask somebody who has this copy. I believe staff in building 4 level 3, I think most of the staff right now has this copy. If not, you can ask me and I will send it to you. For admission as well, a list of documentation that needs to be completed for a surgical patient. So this is one. And also this includes the daily documentation of those who are day 1 post-op, day 2. So there is a guide for everybody, so that no single documentation will be missed. So these are just samples of a pre-planned to-do list. Aside from this, as I mentioned to you, these are just examples. You can still do your own and craft your own depending on the shift, okay? Depending on the workload of that shift. Time blocking, very important. This is a productivity technique where a shift is divided into segments for specific tasks. It integrates a to-do list and an hour-by-hour guide. Okay, it resembles a sort of a schedule. So when you have a to-do list and you put an hour, which hour, for example, bedside rounds and assessment at 7:30 to 0800 after the handover. So you make sure that you limit your rounds and your assessment from 7:30 to 0800. Then you do your medication administration from 0800 to 0830. Then you initiate HIS documentation from 0830 to 0900. Then you go for a break from 09 to 0900 to 0915. So this is sort of a schedule. This is because you combine both a to-do list and an hour by hour guide. Okay, so it is like a schedule. Parkinson's law. This is what the first question that you will. What's Parkinson's law? Parkinson's law is not refer to the Parkinson's disease. This refers to a book or a concept that was developed after Cyril Northgate Parkinson, a British historian and an author, uh, developed this sort of a proverb. It explains that a work expands to fill the time allotted for its completion. Okay, as time management is psychological, the same task can take 1 hour or 1 week, depending on how much time we give to complete it. Okay, for example, if you set a task, there is a task, a certain task. If that task was you are to do that task in 1 hour, okay, and you are still to do the same task, but you are given a week. For sure, you will finish the task in 1 hour. You can also finish the task in 1 week. Okay, on any given task. It means to say that if you put enough more time, the effort also decreases. Okay, it points out that people usually take all the time allotted and frequently even more. There is always a desire to have more time. Okay, if you put your actions, or you dwell your the way you work based on Parkinson's law, you will eventually say to yourself that you do not have the time. You do not have enough time because you get used to having more time, when in fact you can also do the same task in a lesser period of time. Okay, so how to hack it? Later on, I will show it to you. This is a sort of a diagram, or a visual on how to understand Parkinson's law. Okay, as you decrease the time, if there's only available 2 hours, you increase the effort, you get the work done. Okay, the time available now is increased to 3 hours, 1 hour more. Okay, it's 1 hour more than the first one. Then the effort decreases because you have more time. More so if the time available is 8 hours. Okay, you decrease the effort, but because you have more time. But in fact, if you just increase your effort and decrease and just focus on 2 hours, you get the same amount of work done. You got what I mean? So this is the Parkinson's law. How to hack it? Set artificial deadlines within the shift. Artificial deadlines means these are realistic deadlines that you are setting in order for you to be guided that you need to finish this. Like for example, I need to finish the documentation within 30 minutes. I need to initiate all of my 6 patients or 8 or 9 patients, initiate their documentation within 30 minutes. It can be done. Initiating, it can be done, meaning to say that you have started within the first 2 hours of your shift, you have already initiated the documentation. You started with assessment of patients. You have already you have already initiated your notes. Okay, you have already placed your vital signs. Okay, so that means that you just exert effort, focus, exert effort, limit the timing, limit the time required. Okay, set the time that you need this to be finished, and then work on it. Exert effort on it. Try best efforts to meet these deadlines to be able to work for more. If the deadlines cannot be met despite best efforts, modify them. Modify the deadlines, but make sure that you place best efforts in it. And every time you modify, you must make sure to yourself that you have learned something. You have learned something that it is not, it is unrealistic. Therefore, next time you can apply them. This is how you hack the Parkinson's law. You exert effort in a task, do it, compress the time, and exert effort. Exert effort. Make sure that you do it the best way you can. Fifth is have a highlight of the day. It's a simple way of saying to you, have something every shift that you are looking forward to, right? We are human beings. It's common for us to be bored, right? You need to have something that will be your highlight of the day. That's something that you look forward to, because that is something that will make you feel satisfied. It will make you feel fulfilled. Okay, you have to celebrate it. Either you have to have a coffee break or a walk outside. Examples of this are patient discharge. You completed the patient discharge. I remember the first time I had I had the patient, a difficult discharge patient who stayed for us for more than 3 years, who was discharged. Okay, it was a very you feel a very good sense of satisfaction, fulfillment. Okay, so arrival of the fourth admission. Why I placed there arrival of the fourth admission? It means to say that the shift is busy. No, if I am to receive the fourth admission, for example, or the fifth or the sixth admission at 1 p.m., I will be very happy for that. The reason behind is that I still have more time. Still have more time in order for me to do the documentation and to render care. It's better. It's always better than receiving a patient or an admission, let's say at 6 p.m. Okay. So, but if that's the case, I can still find a way to modify it. Okay. Returning of excess medication, knowing that that is the right thing to do, really, and you have completed it. So that is you can make that as your highlight of the day. Look, find something that you can look forward to within the shift that will give you the sense of fulfillment. Remember, time management is psychological. Number six, urgencies are routine. Urgencies, this is where most people will have difficulty in adapting. If you think that something is a sort of an emergency or urgency happened in your shift, then suddenly you become busy. If you are not able to prepare for it, if you are not able to integrate urgencies as part of your shift, as part of your whole time frame of working, then you will end up really with a messed up shift. So the only way for you to be able to adapt to it is to treat any urgencies, any medical urgency, any sort of urgencies as part of your routine. How to do that? You combine those mentioned things, the five things that I've mentioned previously, the five tips. You mix them. You make at the beginning of your shift, you exert already the best efforts to try to finish most of the tasks earlier, especially those of independent actions, meaning you don't need collaborative efforts. You don't need the time frame as well of the physicians. Those efforts that needs only independent work, independent things, independent actions from you. You render best efforts and try to do it as fast as you can. Okay. Remember examples such as meeting a leader in building 6 level 1 at 4 p.m. Okay, so these kind of things are really, it was not planned, impromptu, and then you suddenly have to go to it. Okay, so those are urgencies. Open a unit and adjust the rota. The codes, patient needs, the late arrival of admissions. These are urgencies that you need to work at. It doesn't mean that the late arrival of admissions, I need to finish every doc. No, no, no. You need to receive the patient and make sure that the urgent needs of the patients are taken care of. That's what I am referring to here. But in terms of admission, whatever you initiate, as long as you have initiated it, you can endorse it to the next shift for the next shift to be able to continue. Okay, do not stay up or stay late because you need to just. It's wrong. It's not teamwork. It's a disaster if you are not endorsing the work to your colleagues and not. But do not abuse this. There, there must be a harmonious relationship, a trust and respect between each other, because you know for a fact that your colleague has done the efforts needed. So let him leave at 7:10, 7:30 after the handover. Let him leave because the shift is over. Then carry on. Okay? That's what I am saying. Number seven, effective communication. Very important, very, very important. In order for you to properly do the first six that I mentioned, you need to have effective communication. You need to focus during the communication and communicate politely. Okay? You need to utilize our ice bar. You need to listen and respond. Document properly, part of the communication. You have to build network while you do this. You need to involve patients and their families. It's not only you endorsing to your colleague or you talking to the physician. You are working for the patient, so it's just appropriate for you to involve the patients. I will tell you why later on. Do not forget to appreciate and commend your colleagues. It's not some nurses are just would just like to sometimes out of frustrations communicate with wrong tone of voice. Okay, remember, when you encourage and you feed positive vibes, you will receive positive vibes. Okay, but if you encourage distractions and ill words and so on, you will receive the same, and it will fed you up. It will fed you up, and to the extent that you do not want to go to the shift. But if you try to encourage and feed positive vibes to people, you will be able to get positive vibes and result as well. Those are seven tips. So these are 10 rules of the trade. The tips are just the tip of the iceberg. These are the rules of the trade. When you have those 7 tips that I've mentioned, learn those 7 tips, and then after that, you go to applying them. Okay? When you apply them, you need to understand the rules of the trade. That number one, you own your time. You should never say you do not have the time. You own your time. You own your time, and you will always have a choice. Ponder on that for a second. The reason behind is that people will always say to you, "I do not have time. I do not have time to go to. I do not have time to settle this issue." You always have choice. It's because at the beginning of the shift, you were relaxed and you did not exert best effort in order for you to to finish more tasks or to attend to more to that specific task at that particular time. Okay? Hack the Parkinson's Law. Number two, focus and pay attention to details. Sometimes we are out of focus. Believe me, it happened to me, and all of these words that I am saying, these are not this did not came from the book. These are all, although some, of course, but these are a mix of how I deal with time management since before. Focus and pay attention to details. Okay? Your colleague is endorsing something to you. You did not pay attention. You were not focused. You were writing, yes, but you did not focus. What will happen later on? It will be a disaster later on. And you will take more time troubleshooting rather than focusing on the task at hand because you failed to focus and pay attention. One simple, uh, one simple incident or scenario or situation wherein you were out of focus is detrimental to your whole shift. Okay? Starts with listening and focusing during the handover. Very, very important. And number three, celebrate how small the achievement is. I mentioned about positive vibes. How small the achievement is. Okay? How small the achievement is. You celebrate it. Ask for a coffee. Make your 15-minute break as if it's your highlight of the day. That's fine. You celebrate as long as you know that it makes you feel fulfilled. Number four, do not mix emotions to the task when making decisions. Sometimes emotions are getting the best of us. It it is also being relayed to your colleagues. You are relaying the frustrations, your emotions, unnecessary, unnecessary for them. Thereby, when they grasp your emotions and they put it as well, they grasp your frustrations and they put it as well in the context of the task. And all of you are frustrated. It will come to a point wherein the frustrations is between all of you. You cannot do you cannot do a simple task now because you cannot communicate to your colleagues. So do not mix emotions, okay, to the task and making decisions or when making the task itself. Okay. Change is positive. When there are any changes, that is positive. Modify the goal of the shift as needed, or modify the whole list as needed. You will learn more, and you can apply more later on. Number 6 is you relay the information and do not relay the frustrations. Very, very common. Very, very common that is happening. Why? Why you are fed up? Why you are going home very, very tired? Because you build your conversations and your work all the day on the frustration. Relay the information. Do not relay the frustration. Okay. Be very careful of the words that you say to your colleagues. You trust your colleagues. You delegate the tasks. Most common mistake that the novice nurse will have is that he will prefer or she will prefer to do by himself or by herself a task. If she wants to do it in his own terms, in her own terms, no. Take the risk. Educate your colleagues and delegate the tasks to them. As a team leader, you need to make sure that you are surrounded by people who can also do the tasks or do the things that you can do. Share the information, share the techniques. The way I am sharing this to you right now, share the techniques, share your tips to them in order for them to be able to do the things as well as you can do it. Okay, when you trust your colleagues and you delegate the tasks to them, they will eventually feel independent and they will actually teach the others as well. So you are now an advocate or you are now the source of something, a technique that the rest of the people in the unit or the city or the whole nursing department will have because you trust your colleagues. It starts with you trusting your colleagues. Trust your leader. A help and guide is always near. Okay, choice nurses are there. So if you saw us, if you saw your CRNs, you ask help. You ask for a guidance. They will for sure give it to you. Okay, not one single leader will avoid you. For sure, I am sure about that. Just make sure that you verbalize your need for the help. Okay, involve patients. Talk to them and listen. They will for sure help you. Before I proceed, I will inform you that this is really very important. Imagine if you go for a 15-minute break. Before you go for a break, go and make quick rounds. Okay, 9 patients, then go, or 8 patients, you go make your rounds and you tell them, Ako'y, ano raw barra, I will take for ana sa sharab gawa, okay, I will take my coffee, okay, kamusta siya dagiga, okay, 15 minutes, ano mafi mojo din, I will not be here for 15 minutes. Ishay Alhen, you have anything to do right now, I will help you, okay. I am Joanna, and it means to say that you're really hungry. I need to have the 15 minutes. Involve them, inform them that you are going for a break. And they will help you. They will even tell you, Kalas, you go there. You go. I will not call for anything. Do this among the 8-9 patients that you have. Okay? Not only of your break, of course, but you need to involve the patients in any which way. Imagine, but I'm saying an example of just a funny example. Tell them that this. Hey, I haven't had a break I will have to go for a break. If there's anything you need right now, tell me and I will do it for you. Then once you do it, or they will tell you that they do not have anything for you right now, you go for a break. They will not be using the call bell for sure. Unless otherwise very necessary. Okay? Believe me, involve them. They will help you. They will also, while you do this, imagine the 15 minutes without you, all of your patients will not call for a call bell. So meaning to say, but if you do not do this and you just leave the unit and go for a break without even informing your colleagues, informing your patients here, that 15 minutes is like 12 hours of disaster. You are now generating negativity there. So it takes for you of that single effort to just do your rounds, prior to your break and informing the patients that you are hungry, you will go for a break. And then to be very, believe me, just try to do this. It worked for me. I received kamsa after, and I received a lot of a lot of appreciations after. Believe me, I am all of these things that I'm telling you. This is based on experience. Involve other disciplines. More heads are always better than one. Meaning to say, you involve the rehab, you involve the therapist. For example, as a patient, you found a patient that is not adhering to the carryover skills at night. You inform the rehab in the morning. Hey, the patient, I think is not. Can we be able to give more information to them? Inform them. Then the patient who is now has a problem with complying to the carryover skills will now be able to the therapist will now be able to modify the carryover skills and will be able to help you. One example, only one example. Not to mention your doctors, not to mention your specialist, your diabetic educator, right? Your wound care specialist who happened to pass by your unit and you were having difficulty in translating in Arabic, right? These are your colleagues. You can always ask them for help, and that will make. These are examples on how you can uh, you can make your shift a whole lot better. Involve them. More heads are always better than one. The focus of this time management presentation is very plain and simple. As time management is ecological, I am telling you, time management is very important as well. But how will you be able to successfully manage your time? Manage your time by helping others. Help your colleagues, help the person next to you. Why? The answer is in front of you. When you help others in the shift be comfortable and safe, your team will have more time to help lessen the load of the next shift. Every time your shift works to ensure the next shift has less load, they will ensure the shift after theirs will have less load as well. When one unit exerts effort to help the other unit, you empower that unit to help other unit as well. Imagine that cycle. Imagine if it is true. Not only our patients will have joy, it will be all of us too. Thank you very much for listening. If you have any questions, as I told you, any sources or any references, you can ask me for a copy of it, and I will be very glad to share that with you. If you have any questions, I am ready to answer them. If none, thank you very much for attending. I hope you got something from me based on